Cholera has gripped Malawi for almost a year, with cases registered in all 29 districts and rising. By the 4th of this month, 704 people had already died and 21,000 cases had been registered, and that's according to official data. So what went wrong and why is the virus still lurking in the country? Let's find out in this report from Malawi's capital. This is Lilongwe. Healthcare workers are getting ready to put on personal protective equipment before entering cholera wards. The following announcement from the country's health ministry has sent everyone in panic mode.
We continue to record rising number of cases across the country. Despite signs of reduced transmission and deaths in a few years, we would like to commend those that are availing themselves for the treatment.
Malawi's health ministry ordered the closure of many businesses that lack safe water, toilets and hygienic refuse disposal facilities, and announced restrictions on the sale of pre-cooked food. Hotels and traveling is also restricted. It is that bad. Figures show that about 15 people have been dying daily in recent days, with 155 deaths recorded in the past 2 weeks. Nearly 1,000 people have been hospitalized. WHO Chief Tedros Ghebreyesus says 31 countries have reported cholera outbreaks since December, a 50% increase over previous years.
The outbreaks themselves are both more widespread and deadly than normal. While we have had large cholera outbreaks before, we have not seen such a large number of simultaneous outbreaks. The common denomination for many of these outbreaks is climate-related events such as storms, floods, and droughts.
Africa Center for Disease Control says that 14 African countries are reporting cholera cases, many of which are due to flooding across the continent. A significant proportion of the continent's 1.3 billion people lack access to safe water, sanitation, and good hygiene. Malawi, a country of about 20 million people, recorded 71% of cases and 88% of deaths. That's according to Africa CDC.
I
did not do the right thing. We ate food that was not properly prepared and protected. And at the end of it, all my actions have contaminated the whole household, which is not good at all. I think we all need to protect ourselves from this disease.
We received 2.9 million dosages of the cholera vaccine, but as we speak, we have about 40,000 left. It means Malawians avail themselves for the vaccine. What is worrying, however, is that those who receive the vaccine are not the ones at high risk. Who are more prone to risk are proving difficult to convince to take the vaccine.
Lilongwe and Blantyre City, an economic hub in the south of the country, are the most affected. Cholera is an acute diarrhea or disease spread via contaminated water and food, which can cause severe dehydration. It is a bacterial disease that affects both children and adults. If left untreated, up to 30% of cholera cases can be fatal. And in extreme cases, the disease can kill within hours. Bureau Report, WION, World is One.